the University of Twente in the Netherlands, this is the Experimental Center for Technical Medicine. It's a new, state-of-the-art facility for research and education.
The Experimental Center of Technical Medicine is a stimulating learning environment for students to design and try out new procedures for diagnosis and therapy. But it also has another meaning, experimental for researchers, to test and design new diagnosis, new possibilities to use technology.
The ECTM is situated at the heart of Misra, the fast-growing Institute for Biomedical Technology and Technical Medicine at the University of Twente. The educational role of the Experimental Center is a crucial factor.
Sean, can you prepare adrenaline? This is the human patient simulator, and with this simulator we're able to simulate all different kinds of scenarios. We can give him a heart attack and all different sorts, and it's able to react like a real person, and it's also able to fool these clinical devices, so you can really understand what's happening to these patients.
The students have to learn, based on their own insights, to develop new ideas. And technology is evolving so fast that you can't teach them everything. If you want to apply technology in a safe way in the environment of the patient, of the individual patient, you have to be able to design your own procedures. And that is something we learn here. We teach them skills, but it goes beyond the skills.
The ECTM trains and educates students and also healthcare professionals who work in clinics and hospitals. The center will help them to work with the latest technology.
So medical doctors come here, medical professionals come here for their training courses, and the medical community has really welcomed this environment as a training facility.
At the center, scientists educate students, and together they conduct new research with the latest technology. They are, for instance, developing a new method to enhance treatment of patients with epilepsy, with the help of robot technology.
We are doing state-of-the-art research to epilepsy. We apply magnetic pulses to the brain and see how the brain reacts to these pulses. And then we can make a diagnosis for epilepsy, even when the patient doesn't have a seizure at that moment. The goal of this research is to diagnose epilepsy in an earlier stage. And because we have dozens of different types of drugs, we also want to find the best medicine for each individual patient as soon as possible.
In this research, the goal is not to stimulate the development of the robot arm or the robotics in itself, but the goal is to invent a new and safe way to treat the epilepsy in patients.
The center facilitates cooperation between researchers, medical specialists and students. This unique combination leads to new, practically applicable technology. For instance, using flexible needles, cameras and robotics for precision surgery.
Minimally invasive surgery involves inserting instruments such as endoscopes, catheters, or even needles into the body, and these are done with the least amount of patient trauma, so less scars on the patient. So what my research involves is using robots to make minimally invasive surgery even less invasive. And specifically within this, one of the projects that I work on is inserting flexible needles into the body. So in addition to using MR and ultrasound in order to guide the needle, we also use a robot to steer and insert the needle such that it reaches its intended location.
Today I will be inserting a 1 millimeter diameter needle into my block of gelatin gel.
So the students of the ECTM, or these technical medicine students, come with a unique background. They have both the technical education and also a clinical training. So in this way, since my research is very much clinically oriented, these students can both assist in the lab work and running experiments that are done at the lab here at the University of Twente, but also the interface with clinicians where we can take our research and put them actually into clinical practice.
The mission of the Experimental Center for Technical Medicine, in my view, for now and in the future, is all about education, research, patient safety and innovation in healthcare.